Welcome to Empowered Health. This week we have an amazing lineup of specialists with information to help enhance your health.
That's right. We're going to be hearing about some cutting-edge research that Dr. Greg Kauchak is doing. And we're going to learn more about Botox from Dr. Bahi.
To start, we're going to meet the inspiring Abby Valance.
Abby, at first blush, seemed to be quite well, but then she didn't quite hit a number of the landmarks, and started to maybe question if she had issues with her eyes and her vision. We started to watch her very, very closely and noticed that she was having seizures, so we rushed her to Children's Hospital, and from there on, our journey began.
After 8 long days in the hospital, Abby left, having been diagnosed with cerebral palsy, a genetic chromosomal condition.
A whole new world in terminology and language and things to do for our daughter that developed as she grew and as we learned more about her condition.
Today, she is 11 years old. She is nonverbal, prone to seizures, and confined to a wheelchair. She's had to undergo surgery for scoliosis and a dislocated hip. It has not been an easy journey for the Valances.
I was struggling with trying to cope with working full-time, with looking after a house, looking after my daughter, and I knew I had to take steps to look after myself to continue to look after my family. So I approached our local yoga studio who, and went to a few yoga classes and instantly found a relief and a sense of, not necessarily peace, but I could let go of so much of the things that I carry through my everyday life. And in doing so, I approached the instructor there and I said, just out of curiosity, do you have anybody that works with children with disabilities?
You say, well, we're going to try this, we're going to try that, we're going to try this, try this. You try everything, you're quasi-desperate, whatever, and things don't work.
The Valances were put in touch with Robin, a yoga practitioner and occupational therapist who had experience working with children with disabilities. Abby and Robin had an instant connection.
I wasn't challenging her too quickly. I wasn't forcing anything. We only go as far as she's willing to go. But eventually, she's been able to trust me more. And we work in sort of small ranges. What we're doing is that we're keeping it a positive experience so that the connections within her brain can be made that, oh, wait, my leg does move that way. It doesn't hurt. Why don't I try it out? And all of a sudden, she started going, whoa, like that. It was really exciting when we saw her do it.
The doctor's astounded by how well she's doing, how well she's healed, and the movement and the flexibility she has. So,
yoga therapy is now a critical component of Abby's treatment. It's provided physical benefits and has given her an outlet to deal with the stress and anxiety that come from her health challenges. But more importantly, it's created a special bond.
The best thing about it is that when we tell Abby that Robin's coming over, she's bouncing up and down in her chair. She knows.
Ears. No. Mouse.
Visit us online at vancouversun.com/empoweredhealth to share your personal health stories, ask questions of experts, and leave comments about the series or suggest topics for future episodes. And be sure to pick up a copy of the Vancouver Sun newspaper every Thursday for more empowered health stories and tips. We'll be right back.
All right, here's a little self-disclosure. I'm a big fan of fish, especially living on the West Coast. And lately there's been a lot of buzz about farmed fish.
Fish is a great thing to include in your diet, Michelle. But what should we be looking at when we're picking it up at the grocery store? Randy Shore has a lot to say on this topic. Randy, over to you.
Farmed salmon or wild? The rhetoric is so loud and persistent about which fish is better for you and the environment that no one could possibly sort it out. Add to that, the science is really complex. The environmental picture is cloudy at best, and the pollutants in question are completely unpronounceable. Even scientists like to use acronyms like PCBs and DDT. The fervor on both sides of this debate borders on religious. So let's try to focus on one question. Which fish contains less pollutants, pesticides, and poisons? Wild or farmed? The Institute of Ocean Sciences here in BC recently conducted tests on several species of wild and farmed salmon, looking for organochlorine pesticides, a class of chemicals so dangerous and long-lasting, many of them have been banned for years. A Health Canada study of 129 wild and farmed seafoods collected from Canadian grocery stores found the highest concentrations of PCBs, another mostly banned carcinogen, in farmed salmon samples, but the highest concentrations of dioxins in wild crab. All the products that scientists tested were well below the Canadian safety limits for all the chemicals they detected. But in the last 10 years or so, testing has become so sensitive that they were able to detect trace amounts of more than a dozen toxins in seafoods from all over the world. Honestly, I don't know if that makes me feel better or not. Farmed salmon are treated with a neurotoxin-based pesticide called Slice to control sea lice. And if you cruise the interweb, you'll find a lot of hand-wringing about Slice. But Health Canada has determined that Slice is so safe that fish farms can use it right up to the day they harvest. Depending on how you feel about government oversight of the food industry, that will either be comforting or not. Another potent neurotoxin, mercury, is also found in small amounts in farmed salmon. But mercury is found in almost identical amounts in wild salmon here in BC. Reports of elevated mercury in farmed fish come from Europe. Every reputable study I looked at found that the levels of toxins in farmed and wild salmon are well below our national health standards, which are some of the toughest in the world. When you look at the science, the presence of toxins, chemicals, and pesticides shouldn't really be a factor when you choose your salmon. In fact, scientists are so good at finding these toxins that they are nearly all detectable in breast milk. I'm Randy Shore for Empowered Health.
Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Because you have a spine, it's important to understand what chiropractic care means to your health. Your health always starts with a regulatory college. In this case, the College of Chiropractors of BC serves to ensure you receive care from a qualified chiropractic doctor, both for diagnosis and treatment, today and tomorrow. That's also why BC's chiropractors fund research and education. Today, I'd like to introduce you to Dr. Greg Kotchuk, who's doing some fascinating work in the measurement of your spine.
Say you're in an accident, or we want to use a certain therapy with you. We'd like to have a number that we can follow over time to see if you're making any improvements. And that's why measuring what the spine does is a little bit different than asking what the spine does.
That's exactly it. That's exactly what this device is designed to do. It takes what clinicians measure with their fingertips, but instead of fingers, it replaces what you feel with a specific number generated by the equipment.
When we have a number that's associated with someone's progress, it does a number of things. It can reassure the patient that yes, things are moving along. Maybe their pain level hasn't changed yet, but we can show that functionally things are improving. It can also help us make decisions in a more timely basis if we have to switch treatment or move into some other realm of therapy. And ultimately, each of those things is benefiting the patient.
Collecting this type of data is also key to analyzing some of the intangibles in patient recovery and treatment.
And now because of that, we can ask research questions to say, why is it that some people are getting better and other people may not be? Are they fundamentally different? Can we change the treatment? You just can't answer those questions if you don't have a measurement to go with it.
As you can see, it's not just about what we can do for you today. We're working to build a better tomorrow and better healthcare outcomes for you.
Hey guys, this is Simple Fitness Tips. My name is Jameson Wolf and this is Simona Marion. Today we're going to show you how to perform an effective warm-up and cool-down for your workouts. When designing your workouts, it's important to keep in mind of an efficient warm-up and cool-down. Now Simona, I'm going to get you to start with a dynamic stretch. In your warm-ups, you can perform things like dynamic stretching, static passive stretching, Or, if it's cold out, it may be important to increase internal body temperature. Your warm-ups are important. They promote blood flow and they lubricate the joints. That's it for this one. We'll see you next episode.
Coming up on Empowered Health.
You want to be sure that you're catching things early in terms of using it as a preventative cautionary to prevent any eye diseases and anything like that.
Botox is a neuromodulator. It essentially weakens the muscle's ability to contract, and by doing this around the facial muscles, it reduces what we refer to as the dynamic wrinkles. These are the wrinkles caused by facial expression. The most common area these are used are the crow's feet. These are the horizontal lines seen next to the eyes when Jolene laughs or squints. I use a small mini injection to relax the muscles causing these lines. The second most common place is the corrugator lines, or the number 11s, or as my wife would call them, the lines our children gave her. Here, small mini injections are used to relax these muscles. The frontalis lines are also a very common area to use Botox. These are the lines we see when we are raising our eyebrows. I inject Jolene in between the eyebrows and the hairline for the best results. My personal philosophy is that less really is more. I like to give my patients a subtle change so they will still leave people wondering, does she or doesn't she?
I was really excited when I saw the immediate results. I just felt younger. I didn't feel like my face was so sunken in. I started when I was about 39 and I'm 43 now. And it's great to start in your late 30s because it kind of stops the process of aging.
If you do wear glasses, it's great to come in annually for your eye exam there to see if there's any changes, but even if there are no changes in your vision, it's good to keep up with the ocular health and the visual system as a whole.
That's Judith Balberin. She's an optometrist and she's the type of doctor best suited to examine your eyes.
That's something that most people think is that just because you have glasses, you should go in more often, or if you don't have glasses, you shouldn't go in at all, or decrease the frequency with which you go in for an eye exam, but I do believe that everybody should be going in for an eye exam annually if they are able to.
When she says everybody, she means everybody, from infants on up. Your eyesight is a precious thing and you don't want ailments that could be repaired now or halted to get out of control, because if they do, there's no turning back.
And I want you to push this button every time you see the wavy lines.
The first and most important part of an eye exam is to choose your optometrist wisely. In the case of your eyes, you really do get what you pay for. Beware of come-ons and cheap glasses. Your eyesight needs to be your first priority. Interview a number of optometrists and ask them to outline the steps they take and how long to schedule an appointment for. A quality eye exam should take up to 1 hour. They'll be checking for visual acuity, the muscles that control your eye, peripheral vision, the area around your eye including eyelids, the pupils, test color deficiency, depth perception, binocular vision, central vision, alignment, cornea, anterior chamber, infections, secretions, blood vessels, optic nerve, retina, for dry eye, iris, lens, and they will measure the eye pressure and pupil dilation. And that's just the start. The key is to ensure the optometrist is thoroughly examining every aspect of your eyes, not just for your vision, but for your overall health.
You want to be sure that you're catching things early in terms of using it as a preventative cautionary thing to prevent any eye diseases and anything like that. There are certain things like macular degeneration, which we now know is largely impacted by UV damage. So if somebody happens to have a family history, if we take a look and their eyes do look perfect, we want to be sure that that's the way their eyes look every time they see me. And then each time you come in, we can say, well, yeah, this is progressing this way. And then it's those minor changes that are important.
Once the optometrist is happy with the health of your eyes, then they'll test for vision. This is where you read letters on a wall 20 feet away. They will test a range of lens options, and this leads to the prescription that you require for distance, mid-range, and reading. After the break.
My comfort food when I was a kid was shepherd's pie. So I'm just kind of revising the recipe and using a lot of the same flavors.
This cooking and nutrition portion brought to you by Save On Foods.
Chef and holistic nutritionist Andrea Potter from Rooted Nutrition always has an interesting and healthy spin on many popular recipes. And today she's with me here to do exactly that. Andrea, welcome to the show.
Thanks for having me.
So what are we doing today?
My comfort food when I was a kid was shepherd's pie, and it has ground meat on the bottom, usually some peas mixed in, and then some whipped potatoes on top.
Right.
So I'm just kind of revising that recipe and using a lot of the same flavors.
Okay, but instead of the meat, we're going to use lentils.
We're using lentils, and today we actually have sprouted lentils and beans, and we'll talk a little bit about that.
Okay, so here are all the ingredients. Where do we get started?
I'm going to get you to use this to do the topping, and the topping, rather than just using potato, which is not great for you in a lot of ways. It's comforting,
right?
But it's high on glycemic index, not great for weight loss and stuff.
Right.
So to make it a little more interesting, we're, in addition to a little bit of potato, we're going to add some parsnip and some turnip. So I'm going to get you to peel these, and then we'll just chop them roughly. And the inside, I'll get working on the filling. Does that sound good?
Sure, let's do that.
So I'm tying some herbs,
Right.
rosemary, sage, and thyme, so that when we cook the lentils, they start absorbing the flavor.
Right.
And this is a big cheat, but I'm using a food processor. You can finely chop these. You could put them on the grater if you want, but I am going to put them in a food processor. This is a quick dinner idea.
Right.
It's a little hard on the eyes, but we have a pretty uniform kind of shape here.
Right.
That's all we're looking for. I'm just going to start with a little bit of sunflower oil in the pot.
Okay.
So just add your celery, carrots, onion to the pot. I do it around medium.
Okay.
It's called sweating the vegetables. When you don't want to fry them so that they're brown.
Okay.
You just want them to start to release their water.
Right.
Not bad. I'll just chop these up.
Okay.
So we're essentially just making like mashed potatoes, but we're just adding other veggies to it as well.
Okay. Just to substitute the potatoes.
Yeah. So if you want to pop all of those into the pot.
Okay.
Great. So I'm going to pop these on the stove in the back.
Okay.
And in the meantime, I've toasted and ground some herbs here. I've got cumin, a little bit of fennel seed, some black pepper.
Okay.
And I've also got a little bit of flaxseed, and then I ground it all together.
Okay. And that goes into the
that goes into the carrot, celery, onion mix.
Right.
So usually I soak lentils. These ones I'm not soaking. Well, I found recently on the market here, at least, we're finding these sprouted lentils. And these don't keep their shape really well, so I don't use them for lentil salads.
Okay.
But they're great if they're going to be a little bit mushy for things like soups or this kind of shepherd's
pie. Yeah.
Okay, so what we've got going on over here, the carrot, celery, onion are cooking down with the spices. And once you start to smell the spices, can you get that black pepper hit a little bit?
Yes.
Then you add the lentils.
Okay.
And then just stir them to coat the lentils with the oil, and then you get the flavor. And then that vegetable stock can go in there. Yeah.
Okay.
So I'm going to pop a lid on this. Let it cook for around 20 minutes, half an hour.
About medium heat?
Yep, until it's all absorbed. Cook this, mash it until it's fine or chunky, depending on what you like. And then we'll come together and assemble the shepherd's pie.
Okay, sure. So our lentil shepherd's pie has been in the oven, and how do we know it's done?
It's just a little bit brown on top,
Okay.
and then it's ready to go.
All right, it's time to try it now? Okay. The word of caution, it's going to be really hot, right?
It is going to be pretty hot.
Yeah. It's a perfect substitute for vegetarians, and this tastes equally amazing.
And the thing I love about it is that even people who aren't vegetarian
Right.
can really get behind it, and eating more lentils kind of benefits everybody.
Absolutely. Well, thanks for being on the show and showing us this great adaptation of a conventional shepherd's pie using lentils. You can check out more about this recipe in today's Vancouver Sun, or go to the website vancouversun.com/empoweredhealth. Lentils come in many different colors: red, green, brown. They cook up fast and are super healthy to eat. For some more lentil talk, I've got registered dietitian Crystal Higgins with me. Crystal, welcome to the show.
Thank you.
So, what makes lentils so good?
Well, lentils are a perfect choice. They offer a variety of health benefits no matter what your dietary preferences are. They're perfect for meatless diets, and they're a great substitution for beef in a shepherd's pie as well.
And how do lentils fit into a gluten-free diet?
Well, lentils are naturally gluten-free. They're also low glycemic, which means that they're perfect for diabetic diets as well.
And lentils are really versatile and super easy to cook, right?
Absolutely. And unlike beans, they don't require any pre-soaking. So all you need to do is actually just rinse, boil, and season, and you're good to go.
And for that reason, I'll just tell you that all of them make for a great curry as well.
Absolutely. And if you're looking for other things to do with lentils besides curries, choose a green or a brown lentil, and they are more able to retain their shape, so they're perfect in salads. You could also use them for veggie burgers or casseroles, even adding them to pasta sauce to boost both the protein and the fiber.
And there's another thing about lentils. The smaller the lentil, the creamier it cooks.
Very, very true. And specifically for red lentils, especially if you add them to a soup, it really gives a nice thick and rich and creamy texture.
Well, Crystal, thanks for being on the show, and thanks for talking to us about lentils today.
My pleasure.
I'll see you later.
See you soon.
That's all for this episode of Empowered Health. You know, I'm still thinking about Andrea Potter's yummy spin on lentil shepherd's pie.
You got that right, Michelle. It was really tasty. For more information on any of the stories you saw today, check out today's Vancouver Sun newspaper or visit the Vancouver Sun website.
See you soon.